What's up, Dr. Patel here, and we're going to be talking about ear pinning or otoplasty surgery. So what in the world is that? It's a surgery where we reshape the ears. When people have prominent ears, it can be something of both embarrassment, it can be a problem with wearing your hair, it can be a problem with wearing a hat. And because of that, we do it as early as 6 years old when the ears have fully grown, and hopefully that prevents bullying from those nasty kids at school. But we do a surgery where we make the ears not smaller, but unnoticeable. No one's ever gone and said, oh my God, those ears are beautiful, but we just want our ears to be unnoticeable. What we're talking about is when people have prominent ears or ears that kind of stick out. Now, there's a couple of ways to do it, and this is a whole algorithm involved that as a surgeon, it's my job to determine which techniques are best. The easiest case is when we only don't have a fold of this part of our ear called the anti-helical fold, and using a specialized technique without making an incision, I can numb your ear and put stitches in, and that'll help create that fold. These are permanent stitches that stay in there forever, but with the combination of doing it at a young age where the cartilage retains memory, even if those stitches pop out, the ears stay where they are. Now, some people also have a prominence of the contral bowl or the cartilage more on the inside, and the angle between the bone behind their ear and their ear is really high, causing a more prominent ear, and this requires an incision behind the ear. Now, with this surgery, there also is only about a week of downtime, but you do require an incision and have some stitches that dissolve on their own. With both these surgeries, the recovery takes about a week because you have to wear a head wrap that keeps the ears pinned for that period. But overall, for most people, the pain isn't that bad. You do need to take antibiotics for about a week after the surgery. And if you have the surgery where you have the stitches behind, you need some ointment and some care. Overall, the surgery takes me about an hour to do for the average patient. And like I said, if you're doing it and it's just a quick numbing shot that really isn't that bad, you're in and out of here in about an hour to two. There's a big range of costs around the country, anywhere from $2,000 to $4,000 per an ear. So I do recommend getting multiple consultations and opinions and seeing what different techniques are out there. If you have any questions, feel free to contact our office.